VA Immersive is a program in VA where we discover, test, replicate, and scale immersive technology across the entire healthcare system. It's really about transforming the way we deliver care and the way our veterans experience care. In my role as VA Immersive lead, I have the opportunity of leading a phenomenal team. A team that is all about putting the veteran at the center of the healthcare experience, about supporting our frontline staff, about continuing to lower the barriers and raise the standard to how we think about healthcare innovation, particularly innovation around immersive technology.
Overall, veterans have been thrilled with this virtual reality program. Oftentimes they say that it doesn't feel like work, that it feels like a really nice break from what they're typically doing in therapy sessions.
I feel like a sort of like a little kid experiencing something for the first time. I really would like to do it again, and I recommend it for any veteran who's in the hospital, or any veteran if they could afford to get one at home. It would just really expand their life. You know, I really think that. I did see the Aurora Borealis, and that was amazing because all the different colors. And at one time there was like a lime ice cream with strawberry thrown in it, and it was twirling, and it was just you just don't know if there's anything out there in the world like that until you actually see it. It's just amazing. I love it.
I don't really think that this can compare to the traditional chronic pain management. I've heard them say, I didn't think about my pain when I was doing that. And for them to be able to say that is a huge statement.
It helps to get your mind off your troubles, get your mind off your worries, and go to a sandy beach or look at monkeys or look at the stars for as long as you can use it. And you can escape and just be free in that environment.
Immersive technology offers veterans an ability to access a different approach in a positive distraction sense, but also it allows us to engage in more immersive ways, in engaging ways that the veteran feels that they're a part of this experience, not just a participant.
The more I got to see and experience virtual reality, the more I saw the value. And also, importantly, a top clinical priority for VA across the board is prevention of suicide. Partner that with the ability to augment our mental health staff in general with an additional tool to address some of those greatest challenges, chronic pain and suicide prevention, and you have a really sweet spot of innovation in transforming healthcare, where you put on a headset and your entire reality is transformed. You have the psychological presence of this entirely new environment. We know that chronic pain is something that can lead to suicidal thoughts, and so the more that we can address that pain, the better we can get to suicide prevention.
I've done quite a few of them, but the mountain one I like best. You can look all over that mountain. You go this way, you look that mountain that way, you go that way, you look that mountain, and you look straight off. Makes you feel good, you know. You sit in here all the time, your mind the same way. But you get to look through there, you know, you can see about anything you want to see off there.
As use of immersive technology continues to expand within VA facilities, we're also very much thinking about how to best implement this technology in veterans' homes. But the overall goal of sending it into the patient's homes is that we're also then empowering the patient to be part of their own healthcare journey and adding a layer of continuity of care to the overall veteran healthcare experience.
If you want to become more involved in the chronic pain and suicide prevention efforts, we encourage you to reach out to VA Immersive at va.gov. We'd love to get you connected.